Bethlehem's a specialist palliative care service and has a statewide role in caring for people with progressive neurological disease. Some of the challenges we faced before implementing Vitro really related to multiple clinicians wanting to access the clinical record at the same time.
In my daily duties we do ward rounds, and one of the challenges we faced before Vitro was accessing all patients' information at the time of the ward round.
Vitro is a bespoke electronic medical record. It's built to reflect how clinicians currently work. It reflects their current processes.
Sláinte have been very responsive to working through from the very initial stages when they came and showed us the chart book and gave us some insight into what was possible.
Given the time, if you talk about 6 months from woe to go in terms of getting to the point of implementation, it was amazing, and I'm not aware of any other site or service that's introduced any form of electronic record that have been able to achieve that. So I'm very proud. I'm very proud of the work that we've done, but I'm also very proud of the work that I think we've done collaboratively with Sláinte to get to this point as well.
From an adoption point of view, Vitro has quite a few nursing staff have been quite surprised how easy it is to use.
Several staff actually missed training. They were away on holidays or they were away for whatever reason. So we were trying to catch those people before they actually got onto the floor. But what we found was that people who missed training, they still managed to pick up the system and use it. Because I think the reality is yesterday you were using a piece of paper and a pen, and today you're just using a tablet and a stylus. In most situations, clinicians are expected to change how they work in order to avail of the benefits associated with the clinical system. That's not what we want with Vitro. We don't want you to change your processes, we just want to enhance them.
My children call me Amish woman because I'm technophobic, and I only use a computer for work purposes. I don't use it, in my leisure time, and I've found it really easy. And to tell you the truth, I've actually shown people in my department certain things that are available because I've actually found it so easy. I do play with it and find different ways to go through the system as opposed to just what we learnt in that first information session.
Initially we looked at Vitro when we were considering how we might move into IT-enabled clinical record systems.
The added extras that we put into Vitro for our application was the safety features that we're actually being able to put into our clinical charts, features that allow us to ensure things are correctly filled in, that we don't miss important information, or that even just numbers are added up properly. So for us, they were incredibly important features to enhance safety in our clinical notes.
One of the key benefits has been that we've actually got multiple clinicians can actually access the record at the same time.
A really unexpected benefit of Vitro was associated with the progress notes. We always expected that the legibility would be better, but what we didn't expect was that there would actually be more content. I guess what we realised was that people in this day and age are more comfortable typing than they are writing. So we're getting better quality of progress notes and actually more quantity of progress notes, which is wonderful.
One of the biggest conveniences that the Vitro technology has provided is that many people can access the one document at the same time.
Yes, we are saving a lot of time by not looking for histories. Clinicians are also able to write their notes and complete their stats on the day that they see the patient, and we were never really able to do that before.
The way I do my job now with Vitro, it's a lot easier to access information that I need in a timely way. I'm not spending time looking for records in places where they could be. I know where the record is. It's on my desktop, so it's very easy.
The thing we liked about the Vitro technology was that it was intuitive. So what we were doing there was looking at the charts as they were in paper and digitalising them. So to a nurse on the unit, they just look at a piece of paper and it would look the same.
Since the implementation of Vitro, patients have commented on the presence of staff closer to the patient bedside. They're not having to be at the central nurses station as much because they have got access to various workstations around the ward.
The funniest thing that I remember hearing since the introduction of Vitro was actually when I had a conversation with KE, our chief pharmacist. I was down in the pharmacy talking to her, and
I think she's gained weight because she's not having to get up and find records like she used to.
because now I don't have to keep running up and down the stairs and trying to chase the records and trying to find things.
So she's found that to be the case. So
I think it's probably much better with the tablet. Generally, I think it works better.
I think it just makes it a lot more easier to communicate because you've got that person's full attention and then they're able to access whatever they need to, and it's a lot more personal, I think.
We weren't initially focusing on Bethlehem, we were thinking about a whole of organisation approach, and phase 1 of implementation of Vitro actually occurred at Bethlehem. Phase 2 is to move that concept of IT-enabled clinical records management and systems into the rest of our hospitals.
The future of Vitro with Calvary is not only obviously the deployment in our other hospitals, of which we currently have 14 or so, but it's where this approach could also be utilised. We've got some ideas that this sort of approach of the ability to digitise paper records and the ability then to search it, to analyse it, is just fascinating. Big job in front of us obviously to roll this out, but while we're rolling it out we're thinking about where to next, and there's lots of opportunities in my view.